Hey guys, now we're gonna talk about the anatomy of anterior and medial thigh compartments. So, what do we have in the anterior thigh? First of all, you need to think about your hip joint. So, if you have muscles in the front, you will have muscles working chiefly on the hip to do hip flexion, and these muscles are the psoas major and the iliacus, and the other muscles would be the muscles in the anterior thigh, and they work on the knee joint by doing knee extension. So, what are the hip flexors? We have the psoas major that comes out of the lumbar spine, and then you have the iliacus that comes out of the iliac fossa of your iliac bone, and together they will form one tendon, and that tendon is going to be inserted into the lesser trochanter. So this muscle will basically do hip flexion, and the innervation would be from the lumbar nerves. All right, now if you want to see the muscles on a cadaver, if you guys see a muscle that comes out from the lumbar spine and it goes deep down to the inguinal ligament to reach the thigh, and you have the iliacus, these muscles together will do what we call the iliopsoas. All right, so this is the iliopsoas muscle. It goes all the way to get inserted into the lesser trochanter. Okay. The next muscle we have is the sartorius. If you guys look at this diagram, you will see that the sartorius is a very long muscle. It comes from the lateral aspect. It comes from the anterior superior iliac spine, the ASIS. So if you look at a pelvis, you guys know that we have spines, two anterior and two posterior, and the one anterior and superior is big and bulging, and you can palpate that on yourself. This gives origin to the sartorius muscle, and the anterior inferior iliac spine gives origin to the straight head of the rectus femoris. You guys know that we have the rectus femoris. It's a straight muscle from the quadriceps. Why am I saying that here? Because I want you to relate. From the anterior superior iliac spine, we have the sartorius, and from the anterior inferior iliac spine, we have the straight head of the rectus femoris. And with that, we will be doing the two muscles of the anterior compartment, and the rest of them will be the quadriceps, and we're going to talk about them coming out from the thigh bone itself, from the femur. Okay, so getting back to the sartorius, sartorius is a muscle that comes from above laterally, and it turns all the way medially to get attached to the upper medial end of tibia. All right, so why do we call this sartorius? Sartorius is basically the muscle, we call it, sartorius in Latin means tailor. So the tailor position used to be in old days, he used to sit the floor sitting. So if you guys think about his hip, it's basically doing flexion, abduction, and external rotation. If you guys try to sit crossed legs on a floor, what's gonna happen in your hip joint is going to be flexion, abduction, external rotation. So this is basically what happens in the hip joint. Not only that, if you guys look at the sartorius, it comes all the way to the upper medial end of tibia, which means that it can work on the knee joint by doing what? By doing knee flexion. All right, so knee flexion can also be done by the sartorius. So the sartorius muscle, it's going to do the function of the tailor position. Try to think about it so that you can know what is the function of the sartorius muscle. And remember that all the muscles of the anterior thigh compartment is supplied by femoral nerve. Okay, so this is the function and the innervation of the sartorius muscle. What are the rest of the muscles? If you guys look at the picture here, you can see that this muscle, it turns medially downward. So it was coming from the anterior superior iliac spine, it goes all the way down, and it gets attached to the upper medial end of tibia. So this is basically your sartorius. All right, and that was the iliopsoas. It's gonna do the floor of the femoral triangle, and we're gonna talk about that as we proceed. And then the rest of the muscles we have are the quadriceps muscle. Quadriceps are quadri because they are four muscles. We have one medial, one lateral, one in the middle, deep to this, and then the rectus femoris, the straight muscle, comes on top of it. So you have the vastus medialis. Vastus means vast, means a big muscle. in the medial aspect. You have vastus lateralis and you have the vastus intermedius, and intermedius is covered anteriorly by the rectus femoris. So what is the origin and insertion of these muscles? The insertion is very simple. They all come together to form the patellar tendon, and it goes all the way to get attached to the tibial tuberosity. All right, so they all come together to form the patellar tendon, and then they attach to, or basically the patella is embedded within the patellar tendon. Okay, it's the largest sesamoid bone of the body, and sesamoid bone means it's a bone that grows and it lives and embedded in a ligament or tendon. Okay. So they have the patellar tendon here, and the extension down up until the tibial tuberosity is going to be your patellar ligament. From where they are coming, the vastus medialis and lateralis, they are coming from the medial and lateral lips of linea aspera, from the thigh bone, from the femur, and the intermedius from the anterior aspect of the shaft of the femur. And the rectus femoris, it has two heads. One straight head that comes from anterior inferior iliac spine. Remember, the anterior superior was the origin of Sartorius. Now the straight head of the rectus femoris comes out from anterior inferior iliac spine. And then it has a reflected head, and that comes from the supra acetabular margin, okay, from the acetabulum itself. So we have the quadriceps. So this is the rectus femoris, this is the vastus medialis, this is the vastus lateralis, all right, and the vastus intermedius is deep down there, and then this is the sartorius, all right. Great. Now, what do? They basically do extension, knee extension. And what is the innervation? It's very simple. It's the femoral nerve. Okay, so the muscles we talked about are all supplied by femoral nerve, except the iliopsoas, because they are coming higher up. So this is coming from the anterior ramus of lumbar nerves, L2, L3 lumbar nerves. Now, what are the hip adductors? It's very simple. They are adductors, so we call them adductor longus because it's a long muscle, right? We call it adductor longus, and the adductor longus is covering the adductor brevis. It's below it. Basically, here they are trying to show you the muscle, but in reality, we don't see the brevis unless we remove the adductor longus. All right. So you have the adductor longus, and then brevis, and then you have the adductor magnus, and magnus is a big one, and then you have the gracilis. All right, so the gracilis is going to be one of the adductors, but it doesn't have the name adductor. Gracilis means cylindrical in shape. So it's basically, for me, it looks like the sartorius. Sartorius, it comes from the anterior superior iliac spine, and it turns medially to go to the upper medial end of tibia. But the gracilis, it comes straight ahead all the way from the pubic bone until also the upper medial end of tibia, because in the upper medial end of tibia we have the SGS muscles. We have the sartorius, followed by the gracilis, followed by the semitendinosus from the hamstrings. The SGS muscles, they all get attached to the upper medial end of tibia, and 3 of them can do knee flexion, and 3 of them can support the knee joint. So what else? So we have the adductor longus, brevis, magnus, plus the gracilis, the cylindrical in shape, the long muscle, but in the medial aspect. And the last one is the pectineus. And pectineus means comb, looks like a comb, and it comes out also from the pubic bone. So all of the adductors, they come out of the pubic bone. Most of them, they would come from the body and inferior ramus, but the pectineus comes from the superior ramus. It has a pectineal line, and it also goes to the pectineal line of femur. Remember, guys, when we explained the femur posterior aspect, we said that we have the gluteal tuberosity laterally, we had pectineal line medially, and then the continuation would be linea aspera, and then that will split back to give you the supracondylar lines. So the gluteal tuberosity was for insertion of gluteus maximus, and the pectineal line is basically for the insertion of the pectineus muscle. So basically, pectineus muscle is taking its origin from a pectineal line in the pubic bone to the pectineal line of femur. What about the rest of them? Remember, I told you the linea aspera is the insertion of all adductors. All right, so all of the adductors would go all the way, as you can see, guys, here to get attached to the linea aspera. Now, but the gracilis, of course, everyone knows, it comes, yes, from the pubic bone, but it goes to the SGS, the upper medial end of tibia. Now let's focus on the adductor magnus because it's a big muscle. The adductor magnus, it has two parts. It has adductor part. So if I'm saying it's an adductor part, it means it's coming out from the pubic bone. It has a hamstring part or ischial part. So if I'm saying that hamstring, you guys know that the hamstring muscles, they come from the ischial bone. So that part comes from ischial bone. So it's basically it's a muscle that basically fans out and comes as a broad origin from all of this area here, pubic bone, all the way until the ischial bone, and it goes all the way to the linea aspera and the adductor tubercle. So which part goes to which part? I'm gonna help you to remember that. The adductor tubercle, it has the name adductor. It was supposed to be the adductor part that goes to it, but actually the hamstring part goes to the adductor tubercle, and the adductor part goes to the linea aspera. Okay, so linea aspera, and it also makes sense because all of the adductor muscles, they get inserted into the linea aspera. So the adductor part of adductor magnus would go to linea aspera to do a hip adduction. So we have two parts here. The adductor one from the pubic bone goes all the way to linea aspera. All right, as you can see here, guys, and the ischial part would go all the way to the adductor tubercle. All right, what you can see here, guys, is, can you guys see the gap that is below the tendon of both parts of adductor magnus? Can you see this, guys, this opening? This opening all together with the lower part of femur will do something called adductor hiatus, and we're going to talk about that in a while. Okay, I just want you to see where exactly that hiatus is. It's basically below the aponeurotic parts, the tendinous parts of the adductor magnus, of both parts of it, fanning out all the way between the both parts of insertion and the part of the femur. Together they will do this opening, and we're going to talk about it. And what does it do? It's basically helping us to do adduction. What is the innervation of the adductor? It's going to be the obturator nerve. Okay, so anterior thigh compartment, femoral nerve, adductor, it's gonna be obturator nerve, except, you guys, the pectineus. If you guys look at the pectineus, you will find that the pectineus is actually coming in the anterior thigh. Okay, it's one of the muscles in the anterior thigh. So actually, yes, pectineus is an adductor muscle, and it also helps in flexion, but the innervation of pectineus is actually femoral nerve. All right, it's gonna be femoral nerve. Let's go ahead and see those muscles. If we look at the hip adductor, what you guys can see, if you guys look at this, we're gonna talk about the floor of the femoral triangle. I just want you to know, once you are in the pubic bone and you can see muscle in front of you, this is gonna be the adductor longus. All right, so this is adductor longus. The first muscle you get to see is adductor longus. When you cut this muscle off, all right, if you cut it off, you will see the adductor brevis. So this is adductor longus, and this is adductor brevis. You need to remove the longus in order to see the brevis. Otherwise, you cannot see it. So if you see a regular thigh with this sartorius here, and this is the tensor fascia lata, and this is the sartorius, vastus medialis, vastus lateralis, rectus femoris. The one you can see here is the adductor longus. Once you remove it, you can see the adductor brevis, and here is part of the adductor magnus. All right, guys, and the cylindrical one in the medial aspect is basically the gracilis. If you guys can see a separate muscle, cylindrical in shape, going all the way straight, that to me it looks like the sartorius, but it has a straight course medially. This is the gracilis. All right, And where would be the pectineus? It's gonna be basically this muscle. All right, if you guys can see a muscle here, it's basically reflected here. How will you remember that this is pectineus? I will give you a mnemonic once we reach the femoral triangle, and I will explain the three muscles again: the iliopsoas, the pectineus, and adductor longus. All right. Iliopsoas here, pectineus here, adductor longus. Once you remove the longus, you can see the brevis. Okay, guys.